All right, what are the effects on massage as it pertains to a herniated disc? So many people that have this problem, obviously seek out different kinds of care, right? So it could be going to the doctor, it could be going to the chiropractor, the physical therapist, maybe even the massage therapist, because often when this happens, when that disc issue, whether it's in the neck and it's into the arm, shoulder blade, trap area, or it's in the lower back, and you feel that tightness, that which all the world feels like, muscle tightness in the glute, maybe in the hamstring. You may even lose actual motion. Like, I can't get my knee all the way straight because that hamstring is really like tightened and locked up, or I can't actually move my arm, all the way I want to because there's actual tightness back there. So the common thing, we'll say, okay, I'm going to go get, some soft tissue work done, a massage done to help this. Now, that can be very beneficial for the superficial, muscle tightness, but the only issue with that at this point is a massage cannot get deep enough into the tissues, into the actual joint space where that, so the bone and the disc is where that it's a joint problem. So it's too deep for a massage therapist to actually, affect the actual cause of the problem. So many times it will feel better, temporarily, and that's why you might feel that way. Even where it's like, it feels pretty good while I'm there, but then, after I get back into my normal positions and postures and movements and the things that turn it on, it comes back because it's more of a posture, it's more of a position and joint and load and activity issue as opposed to a true musculoskeletal issue. If it's muscular, then the massage will be very effective. And that's another way to kind of differentiate. So you'll know it's joint when you lose motion with turning or going back, or you lose motion with bending forward or going backwards, and you have that peripheralized or radicular symptom. And then massage can be beneficial at times, but it comes right back, is because it's deeper, it's a joint issue. Now, should it not be done at all? No. I mean, I would use it in combination with some other deeper, more specific joint movements. So going and seeing an appropriate chiropractor for this, one that's not just a, let's just like rack and crack, and especially if you have back pain and they only treat your neck, that's wrong. Run, that's not the right one. I mean, it has to be specific to that joint. So if you have low back pain, there needs to be a plan in place. There needs to be a reason and a specific, movement, not a group of 10 exercises they give you on a piece of paper and say, here, just try these, good luck. It's got to be specific to that area, to that joint. And there's a reason. There should be an absolute cause and effect behind that, where if I do, as a result of doing X, whatever that movement is, I'm able to take the pain, out of my leg, out of my arm. My mechanics improve. I can turn and move better. The symptom response is positive. It's moving pain from the periphery to the center, or it's reducing the intensity of the pain. So those things need to happen to be an appropriate and effective treatment plan. Then, of course, the massage, if there's anything left after that where, I still feel a little bit, tight in areas, okay, go ahead and get that done. But that's how those things all relate together, and why strictly only going to massage therapy when it's due to a disc or deep joint disc pain will not ultimately be effective for you because of the depth of that problem, and you need actual physical mechanical movement and a plan that you need to do at home to help yourself overcome that and fix that long term. All right, thanks a lot.